Hi, I'm Dr. Sabrina Shah-Desai, an aesthetic oculoplastic surgeon based on Harley Street in London. I'd like to talk to you about skin cancers. Now, the skin is composed of an outer layer called epidermis, which contains squamous cells, basal cells, and melanocytes. And then it has a deeper layer of the skin, which is called the dermis. And this contains hair follicles, oil, sweat glands, and blood vessels. Now, skin cancers can arise from any of these cells, each type having a characteristic clinical appearance, and generally a biopsy or tissue sampling is usually required to confirm the diagnosis of a skin cancer. Fair-skinned individuals develop skin cancers far more frequently than darker-skinned people. And excessive exposure to sun is the single most important factor associated with skin cancer of the face, eyelids, and arms. Skin cancers can also be hereditary. Now, the one thing you can do is wear your SPF to protect yourself. The most common type of skin cancer seen in the eye area is basal cell carcinoma, also called BCC. This arises from the basal cells. It's also called a rodent ulcer as it grows very slowly. The second most common skin cancer in the eye area is a squamous cell carcinoma, and this is a more serious form of cancer than BCC because it can metastasize and spread to other parts of the body. Now, either may appear as a painless nodule or a sore that won't heal. The skin may be ulcerated, there may be bleeding, crusting, or distortion of a normal eyelid structure and loss of eyelashes or hair on the skin. Melanomas are arising from pigment-producing melanocytes, and these are a very serious form of skin cancer. A mole that bleeds, becomes tender, changes size, shape, or color needs to be seen urgently by a physician. Now, sebaceous gland carcinomas are a far more serious and rarer form of skin cancer, and they may appear as recurrent chalazions or persistent eyelid inflammation, chronic red eye, or thickening of the eyelid. Both melanomas and sebaceous gland carcinomas can spread to other parts of the body through the bloodstream or lymphatic system. Therefore, prompt aggressive treatment is necessary because of the risk of early spread. The most important thing is to pick up skin cancers as early as possible. If you detect them at an early stage before they've had a chance to spread around the body, there are a number of different treatments available that work and are highly effective. Now, I work with a Mohs dermatologist and a private skin cancer MDT to appropriately manage skin cancers using best practice guidelines. The best method to treat eyelid skin cancers following a tissue sampling is by Mohs micrographic surgery. Now, this is a short procedure, usually done as an outpatient procedure under a local anesthetic by a Mohs trained dermatologist, and then the skin cancer is usually removed entirely in one visit, followed by a reconstruction of the eyelid by me at another hospital under local or general anesthesia, depending on the extent of reconstructive work required. I hope this little video has given you some insight into eyelid skin cancers. If you need more information, please don't hesitate to visit my website or contact my team at Perfect Eyes Limited. I look forward to seeing you.